Hello, my name is Frank L. Ludwig. I'm a childcare worker, poet, and autism advocate, and you can find all my writings on autism at autismappreciation.com. This piece is called ABA, When Children Are Not Allowed to Be Themselves. The Office of the High Commissioner for Human Rights at the United Nations once stated, "Autistic persons are particularly exposed to professional approaches and medical practices which are unacceptable from a human rights point of view. Such practices, justified many times as treatment or protection measures, violate their basic rights, undermine their dignity, and go against scientific evidence." Applied behavior analysis is not a cure for autism. It's a personality-altering conversion therapy, camouflaging the real person at a terrible cost. Problematic and undesired behaviors have causes. ABA intends to change these behaviors without addressing the causes. As a concerned parent, you want what's best for your child, and a lot of professionals and other parents will have you believe that using ABA against your child is the solution to all problems. It is not. Imagine you were born into a world where everything, including writing, is done with the left foot. Every sentence has to begin with "Simon says," and breathing through the nose is considered rude. Your mom is very distressed because you are so different from other children, and in an attempt to make you fit in better, she gets a therapist for you. The therapist sits down beside you and gives you a pen and paper. "Simon says, can you write any letter?" he asks you. Silly question, you think. I could write a novel if I were allowed to use my hand. You reach for the pen, but the therapist holds down your hand with his foot and reprimands you. "Simon says, what do we write with?" You finally give in and desperately try to get hold of the pen with your left foot. After minutes of struggling, almost succeeding but then dropping it again, you eventually get a grip of the pen. "Simon says, good girl," or "good boy." The therapist remarks and gives you a dandelion leaf. You don't know what the story with the leaves is, but since they are very prestigious, you are very proud to get one. You now proceed with your attempt at writing a letter. An O would probably be the easiest one. And even though you fail to complete the circle properly, the therapist exclaims, "Simon says, excellent, you're making great progress," before presenting you with another leaf. You say, "I have to go to the toilet." "Simon says, I can't hear you." "I really have to go to the toilet," you insist. Simon says, "Nobody takes notice of what you say. Do you know why?" Simon says, "I have to go to the toilet now." Simon says, "That's better," your therapist replies and takes out another dandelion leaf, while you are waiting for permission to go. Your anxiety level has reached a new height. You breathe heavily through your nose. With a disgusted frown, your therapist pinches your nose and reminds you, "Simon says, how do we breathe?" This is applied behavior analysis. You will find that the majority of parents who subjected their autistic children to ABA, which has also been used to reprogram homosexuals under the name conversion therapy, swear by it, while the majority of autistic individuals who were exposed to it absolutely abhor it. The reason for this is perfectly simple. While ABA makes life easier for parents and caregivers, at least for the time being, by getting rid of undesirable behaviors and enabling them to pass their child off as more normal, the child is put under an unbearable pressure to conform, perform, and obey without any considerations for their feelings, needs, desires, abilities, and emotional safety. A former ABA therapist states that she repeatedly found that she had to make a choice between doing the ABA and respecting the child. Rather than tapping into the enormous potential of the autistic mind, it forces the child to copy the behavior of non-autistic persons. Just like forcing a left-handed person, who might be a gifted painter or sculptor if allowed to use their stronger hand, to use their right hand doesn't make them right-handed, and like training a fish to climb a tree doesn't make them a squirrel, Forcing your child to copy non-autistic behavior will not make them non-autistic, and it will induce feelings of incompetence, inferiority, and self-loathing. Had the likes of Leonardo da Vinci or Albert Einstein been subjected to ABA, we wouldn't know their names today. ABA comes in many different forms, from short, friendly sessions to the electro-torture at the Judge Rottenberg Center. And a lot of well-meaning advocates claim that their own version is more positive, more accepting, and more respectful towards their child than others. I will not go into details about the significantly different approaches because the problem is the very concept of ABA itself, the conditioning of an individual. ABA is designed to make the child act in a socially acceptable manner so they can be presented as normal as possible. This provides parents and caregivers with great relief and convinces them that their child progressed. But getting the child to function in the desired way comes at a price. Firstly, it teaches the child that they are broken and need to be fixed, like an object in a repair shop. It takes away the child's self-esteem, their personality, even their intellectual and physical autonomy, and replaces all these with self-hatred for being such a burden. After they have been forced into submission and programmed, they function like a mindless robot without any sense of identity. Secondly, ABA only addresses the symptoms, not the underlying problems of the orientation. The causes, such as sensory overload, remain and build up, which in the long run can cause major meltdowns and serious mental health issues. Furthermore, the heightened pressure, anxiety, and helplessness experienced during the therapy very often leads to severe post-traumatic stress disorder. And there is also a plausible case for ABA causing obsessive-compulsive disorder for the same reasons, as well as for depression and regressive autism as a result. Ben and Virginia King wrote in an open letter, "Could it be that the sudden major regression is common in ABA programs rather than common in autism? We find this premise to be consistent with our training in depth psychology. According to Sigmund Freud, regression takes place in the face of acute trauma and overwhelming anxiety. We posit that behavioral modification can be a springboard to many serious maladies and maladjustments." The link between ABA and PTSD was proved in a study in 2018, which found that autistic persons exposed to ABA are 86% more likely to develop PTSD, 41% in adults and 130% in children, than those who were not. Because ABA takes away their self-esteem, and since studies frequently mention camouflaging as a high-risk factor regarding the enormous suicide rate of autistic people, it is most likely that former ABA victims make up the majority of cases. Thirdly, the child is taught that their value depends on their obedience, and that their appreciation is subject to their subservience. In many cases, they are also denied access to things of interest, and sometimes even basic needs such as food, unless they are compliant. While this type of treatment would be demeaning for any child, or adult for that matter, it is even more detrimental to autistics because of their increased sense of individuality and identity. Because all this, learning that they have no right to control their own minds and bodies leaves the child vulnerable to all kinds of mental and physical abuse, since they have no way of distinguishing between authorized and unauthorized abuse. Many defensive parents will claim, "But my child enjoys the therapy." There can be several reasons why it may look that way, such as having access to objects of interest that are usually withheld from them, trying to please someone who has unlimited authority over them, or the even more distressing atmosphere they're exposed to if they don't act happy. In a highly recommendable article on the subject, Ruti Regan writes, People who can't say no can't say yes meaningfully. Looking happy isn't meaningful if you're rewarded for affecting happiness and punished for looking visibly distressed. Making the best of a bad situation isn't consent. Also, it's a sad fact that a frequently repeated lie is eventually believed by most. People promoting ABA more often than not throw the term evidence-based into the discussion, even though the vast majority of studies in support of ABA don't use control groups to compare the results with, which is quite an unscientific approach. And even when it comes to the few controlled studies, according to a scientific review, there is not enough evidence to corroborate ABA's preponderance over other alternatives. ABA is often compared to dog training. However, one professional dog trainer points out that dog training is different from ABA, since the feelings and needs of the animal are being taken into consideration. Regarding ABA, she concludes, "I wouldn't treat a dog that way." In conclusion, subjecting your autistic child to this dehumanizing treatment will cause them tremendous suffering and irreparable mental damage. Then what is the alternative, you ask? Your child is autistic. Your child will always be autistic. Even if they learn to copy normal people, follow prompts like a trained dog, suppress their identities and emotions in order to fit in, your child will always be autistic. Accept them for who they are instead of trying to break them. If you think about it, who gets hurt if they stim, don't make eye contact, or refuse to hug on command? And if some of their behaviors cause injury to themselves or others, find the cause for this behavior and solve the problem at the root. After all, isn't your child's welfare and happiness more important than your desire for them to appear normal? Focus on their strengths and abilities, encourage their interests and draw on them for teaching purposes, explain to them why they have to perform certain chores, pay attention to their nonverbal communication, avoid pressure in situations that may cause sensory overload, and I assure you that if you learn to appreciate your child's autism, so will they. Thank you for listening. Once again, you can find all my articles at autismappreciation.com. See you.